Hello and welcome to episode 68 of the Dental Realist podcast. I am Dr. Ryder Waldron and I am joined by Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going today?
Going pretty well, thank you. Had a little bit of a break here, and I'm just really glad to be done with dentistry today because I know you guys love second molars more than I do.
Well, yeah, just explain your love for second molars right off the bat, Troy.
So the last 3 days, I think I've pretty much done 8 hours a day on second molars, and I'm just not real fond of them. I think they should be extracted instead of restored.
Oh man, ain't that
They are
the
so.
truth?
Oh man, they're hard to restore. It's just
Marcus, how are you doing? Oh, sorry, Troy. Sorry, Troy, you're done.
You cut me off. It's
Sorry.
okay.
That's
No,
all
it
we
wasn't
had.
important.
We
It wasn't. No,
Yeah.
Marcus, how are you doing?
My bad.
Yeah, enough of that, Troy.
I know, right? Let's talk positive stuff.
I thought
not
you were
negative.
done. I thought you were done.
You're good.
Oh, I'm doing all right. I just got done with a spin class, so I'm I'm feeling tired. I may fall asleep partway through this podcast.
Well, hopefully our listeners don't.
How could they with the stimulating conversation we all carry on?
That's right.
Yeah. Now, did you teach this class, Marcus?
I did a few of the tracks. Yes, it's me and another instructor.
A few of the songs.
Yes, a few of the songs.
Okay.
So how do you exactly do spin classes to country music? I don't understand how that can even energize you.
Well, I can promise you I don't pick country music.
Oh, okay, gotcha.
Do you wear chaps when you ride this bike in spin class?
Yes, with no pants on.
And a cowboy
With no
hat
pants on.
and boots, right?
Yes, of course.
Gotcha.
Oh boy.
Yep.
Well, guys, we are going to finish off our discussion on the 25 tips every dentist needs to know. That is from an article by Dr. Don Deems. And we left the listeners with a cliffhanger after number 12 last time. So we will pick up on number 13 of these 25 important tips. So, Troy, since I cut you off earlier, let's go back to you. I'm going to ask you about number 13, which is develop partnerships with your staff. Explain how that could be important to a dental office.
I feel more like I've had developed a partnership with the second molar because you cut me off, so I got to keep going here. You know,
that's right.
Let me continue my rant.
Molar.
No, I'm just kidding. But yeah, I think that this is pretty important stuff. Your staff makes your life a lot better if you have a staff that has cohesiveness and you're on the same page with them. You're striving for the same goals. It's going to make your life a whole lot easier than when you're dealing with, staff members that maybe aren't on the same page as you. We've all had it where, you have that one staff member that fights everything you do, the things you're trying to do. And sadly, it's easier just to get rid of them than it is to deal with that stuff every day. So I think it's important to have that, the staff cohesiveness, their ideas, their input on how the office is going and what they can do to improve or what we can do to improve.
So if you had to pick a second molar that you hate the most,
oh
which
hey,
one
hold
would that
on,
be,
we're moved
Troy?
on from that.
Well, we got to know
I'm
what is the
having
worst as a
PTSD now.
left-handed dentist. As a
yeah.
left-handed dentist, what is the worst second molar to work on?
I hate number 2.
2, 15, 18. Yeah, 2's a sucky one.
2's a
Especially-
horrible
yeah.
one. I just can't do it. I think I need to throw in my license because I think I'm pretty much not capable of treating a second molar anymore. Yeah, I'm surrendering. What did I say in the text? I said something like I have succumbed to dental decay or something. That it's won the battle.
Yes.
Remember how I said that? Yeah. That was,
Yes.
I don't even remember what I said.
Oh man, that's good. Well, Marcus, let's go to number 14. This goes kind of along with number 13, and it is support each staff member to be a 10 at whatever their role is in your practice. So Troy mentioned, some staff members who really aren't pulling their weight. What do you think about that one, Marcus, number 14?
I think, look at I guess I'd say look at any barriers that there might be that are not letting that staff member perform at their best. So, does that mean they don't have enough training? They need different materials, equipment, something that could make it so that they can be the best that they can be and do their job the best they can. So that's kind of the direction I'm taking it.
Yeah. Yeah, that makes sense. Yeah. Both of those kind of go along with each other. Like Troy said, we've all had those staff members that it just feels like no matter how many times you talk to them, no matter what kind of training, whatever, they just don't seem to have an interest in making themselves better. And they're just kind of coasting, and it really sucks for everybody.
Yeah, and I think there are times when you look at it and you say, this person has every tool, every opportunity the rest of my staff do, and everybody else seems to be able to do the job. And if there's that person that you've given those opportunities to and you've talked to and they just still aren't doing it, I mean, that's when you just got to kind of make those tough calls and say, we might be better off without this person, even if we can't replace him immediately.
Yeah, it's true. Troy, let's go to number 15. One of your favorite teeth, also number 15.
Yeah. Oh my gosh, are you doing this on purpose? Oh, geez.
Well, you never know. This one is ask for referrals from your existing patients, especially you. I don't know. Does that mean you treat yourself as a patient? I don't know, but
I think it's mainly.
What do you think about asking?
Yeah, it's for the doctor should be requesting the referrals.
Okay.
Not maybe necessarily your staff. That's the way I took it.
Yeah, that makes sense.
Yeah, I mean, this is a good thing because it is the best source of referrals for you. If you have a patient that has actually been happy with, what you did and things like that, it's always nice to, ask them to have, their friends and family or whatever come in and take care of them as well. I have a hard time with this. I'm not a very good marketer. I don't feel like I want to be a salesman. I think we've talked about this in some podcasts before, but I hate salesmen.
Yes.
I hate's a strong word. I don't like salesmen. I don't like how they always after you they need to sell you every little thing. And it drives me crazy. And so I hate the fact that dentists sometimes succumb to that. It's like, I've got to sit and just go every single person. You know what? Just let it be natural stuff. Talk to them. If it feels right, ask. If not, don't. If it sounds awkward, if you're just pulling it out and saying, I just got to hurry and ask for a referral here, then that's probably not, the best way to approach it. But, if it's a natural thing and, things like that, that's fine. But I don't know. I think that is the best way to build your patients versus like an advertisement and stuff, because word of mouth has always been our best form of referrals.
Yeah, it seems like people who come from, an advertisement or a sign or something like that, they get pulled in by that, and they'll get pulled in by the next advertisement also. I've been to some courses and they'll say, ask the patient right then, like if they have a good experience, like, will you ask, or, invite your friends to come to our practice? To me, that feels a little desperate. So how do you guys, like in a comfortable way, ask them to refer without sounding too salesy?
That's the thing I don't like. That's the reason why I don't do it as much. I don't know. That's the part that I like how you said that, Ryder. It really does come to me personally, and this is just the way I take stuff. It comes across as desperation, like, holy crap, my practice is failing. I need you to send in everybody you can because I gotta keep this afloat.
Yeah.
I kind of like just having that, just treating people so good that they want to do it, even whether you don't solicit that.
Yeah.
Which I have that happen all the time. A lady comes in, we treat her really good or whatever, and so next thing you know, her husband's coming in.
Yeah,
and she says, "Oh yeah, my wife had a good experience, so I came in."
Mm-hmm.
Those kind of things, and I didn't even say anything to him, kind of thing. So I don't know. I do think it sounds kind of desperate sometimes. Maybe that's what I don't like about it.
Yeah, I've done the, if they say it went so well, really enjoyed it, well, tell your friends about us, tell your family about us or something like that. I don't know. Nothing too, that doesn't sound desperate. It sounds like, whatever.
Yeah.
Marcus, I know this one is near and dear to your heart. Develop relationships with specialists that you refer to. You love to take a specialist out to lunch, don't you?
He loves a good lunch meeting.
Yeah, that's right.
Nothing like small talk about dentistry during the lunch hour. It's really heartwarming and just
Yeah.
what I love to do. I like
Yeah.
in number 16 how it says take some time to find out about their practice and what types of procedures they enjoy the most. Well,
Okay, so what if it's an
if they're an
endodontist, Marcus? What do you
endodontist,
think?
they like root canals.
They are a specialty practice, so they probably have a pretty limited scope of what they are doing and what they enjoy doing.
He's an endodontist and he loves doing crown and bridge. Oh, okay. That's not going to work for me.
Yeah,
that's right.
Yeah. No, I do think it's a good idea to build a relationship with a specialist. I've talked to a couple of them that I've gotten to know fairly well, and I know most of them that I've talked to don't like the person that never refers to them except when they're like in a bind,
Yes.
Never refer to me until they're trying to take out a third and it gets beyond what they can do, and now I've got to be the hero and everything they've already butchered I've got to go through. Or same with a root canal, they never refer to me for endo until the one that they tried, they can't find one of the canals, or they broke a file, or so I think it's good to build a relationship with them, and if you're never going to refer to somebody until and unless you have emergencies, it might be good to be upfront with them and just say, hey, I love doing this stuff too. I'm probably not going to refer to you too often. It's probably going to be if I run into something that's really crazy. At least that we expected it.
Mm-hmm.
Yeah. I had an oral surgeon recently tell me that exact same thing, that he is more than willing to help people out after they break a tooth or something like that. But if it's not a referring dentist, he's like, yeah, I'm not going to stick around after 5 o'clock to bail you out if you never refer to me. So yeah, it's good advice, Marcus. I'm going to come back to you with this one, Marcus. Number 17, which I am sure none of us have done before. Offer free in-office seminars on topics people want to learn about most. Have you ever done that, Marcus?
I can say with 100% certainty I never have, and never will.
Yeah. Troy, what about you?
We have people come into our office, do seminars for us. It's not like we actually, solicit other people to come in and then have our patients come in. Yeah, I don't know. And personally, I'm not a big fan of a lunch meeting. I just, lunch is sacred time, and I need to go clear my head, and I need to go take a nap. So I don't like totally anything about that at all. A lunch seminar anyway.
It's an interesting concept.
I don't really want to have an afterward, seminar, because that would require to stay after 5 o'clock.
Yeah,
I got to get home and sleep, or whatever.
Yeah. For a real salesy dentist, maybe this would be a great thing. You do a seminar on whitening or something like that, they could have some potential patients come in and sign up for it or make an appointment. But I don't know if this is in our wheelhouse. But what I know is in Troy's wheelhouse is number 18. Do you see a trend here? Tooth number 18, and it's also number 18, give unexpected gifts to your patients. So we're back to that second molar number, Troy. And do you ever give unexpected gifts to your patients?
Nope, I never have. I don't even know where that would be.
Like appropriate?
Yeah, he says here, don't go overboard on this. Just to be thoughtful and appropriate time. Okay, I guess. All right, I guess I have. Like, for example, family member dies, or something like that.
Okay.
We'll send them a card, or something like that.
Yes.
Yeah, a card. The whole staff will sign it. Something along the line. We have done that. I haven't necessarily bought a gift though. I mean, I don't know if you thought about, if a card's a gift. I don't know if you would call that, but I have not done that.
Oh.
Yeah, that's an interesting one.
Yeah, Marcus, you ever given a gift to a patient just kind of unexpectedly? I don't know that I have.
Yeah, just I always give everybody a birthday present. It's just how I've been.
Yes. Give them a candy bar for their birthday.
Yeah.
I
think it's a good idea to, if you do know that, there's been a death in the family, or there's some big event or something special, it's probably not a bad idea. And I've done that, a card or something like Troy was saying, but just out of the blue gifts, I don't know about that.
Yeah.
Yeah, I knew a dentist who would send every patient on their birthday a gift card or a postcard to Jamba Juice for a free smoothie. And, I'm thinking if you had 1,000 patients, which is, I don't know, average practice, low end practice, I don't know, that'd be, $7,000-8,000 a year you'd spend on these things. So he stopped doing that. But I mean,
Mm-hmm.
I would like that if I was his patient. But yeah, so I have never done anything like that.
Nope.
Let's see,
Neither have I.
Marcus, develop a written, this is number 19, develop a written 12-month marketing plan and stick to it. Do you have or have you ever had a marketing plan in your practice like this?
I don't know that I've been that religious with it. Like I definitely have paid for some marketing, radio or other things like that in the past, and so it does kind of come with a commitment that you're going to be doing this for 3 months or 6 months or something like that. But it's not a bad idea. I mean, you set goals for everything else, figure out kind of what you're committed to put into marketing, and have a plan and stick to it. I think that's a smart idea.
Yeah, seems like having a budget and everything. Troy, do you do much marketing in your practice?
Done some more recently with the transitioning of a couple of docs. One of ours now is as a partner of ours, and another associate of ours. But I wouldn't say it's a 12-month plan. It's kind of more like a 4-month plan. We plan when to do it based on when the doctor is going to come in to, kind of build awareness that, hey, we have another doctor, we have some different hours and stuff like that. That has been, but the thing that's interesting is the more we've run these ads and done more, the less and less efficient it is, or the less less ROI we have. I think every time we run one, we get less and less response from it. It's really strange.
Interesting. Yeah, that is. I do most of my marketing money goes to like website SEO stuff. That's where I get a lot of my new patients. So yeah, I don't have a big plan like this, but I think it does make sense. Now, this next one I kind of like, Troy, and it is know your target audience. It's talking about, know what procedures you like to do and focus on those. I don't know. What did you think about that one? I thought that's kind of interesting.
Yeah, that is kind of interesting. As a general dentist, your target audience is pretty much everybody, right? So
yeah,
that's an interesting. Yeah, I guess the reality is, like he says here, you can't treat everybody, and you can't. There's certain people that you just, no matter what you do, you can't please them. But I don't know if that's what he's referring to or not. But general dentists, we pretty much appease to everybody, except for children. I don't see anybody under the age of 18, just because I don't like hurting kids. I refer them all to you, Ryder, because I know that you love working on small children.
There's nothing I love more than doing a pulpotomy in a stainless steel crown in 15 minutes. Yes. No.
But
hey,
Troy,
did you have go ahead, Marcus. Sorry.
Do you find, like, being in a practice with multiple doctors, that it's a little easier to essentially be a general dental office, because between the bunch of you, there's usually one of you that is good at kind of everything, or can do some things more than the others? Or
my one partner is he's the master of everything. He likes to do all sorts of stuff. So anything, like surgery, I don't do any surgery anymore. I don't even take out teeth. Actually, I had a lady today, she's been a patient of mine for 20 years, and she's like pleading me to take a tooth out, and I'm like, no, I'm not doing it. It was broken off at the gum line, and subgingival decay and previous endo, and I'm like, this is gonna be a flipping nightmare. So
yes,
I don't know. My business partner, he may not want to take that one out either. I don't know, but it is much easier for us because we do have 4 docs here that are willing to do certain things, and usually one of us can take care of it.
Well, Marcus, you are kind of in this situation because you only do crowns. So has that made like your life easier?
I will have to say it has. I mean, honestly, it's just, I mean, that's one thing in dentistry that I've always, if I'm going to say there's one thing I've enjoyed the most, that's it. And so just being able to focus on the one thing, doing same day crowns, CEREC, all that stuff, it's much easier than trying to be the general dentist doing fillings and extractions and endo and removable and hygiene exams. And that's a lot. It really is.
Yeah, that's true. Yeah, I think you're in a great spot doing crowns all day long. I think it's great. Have you guys, this next one, number 21, is schedule wisely. Do you guys use any, well, Marcus, you do. You just have scheduling blocks for crowns. But Troy, do you use any scheduling blocks for it's the like rock, water, sand scenario where you put the block out a lot of time for a big case or crown or bridge or whatever, and then, fill in emergencies where they can? Do you do that right now?
We do a little bit of that, yeah. Usually we'll put, like the first of the day we'll block out for high production, and then right after lunch, high production, and then kind of fill the rest in. Our hygiene, we do it quite well. I'd say we used to do it quite well. We'd like block out time for root planing and stuff, so we didn't have to say, hey, you really need root planing, and we can see you in 3 months to do it, kind of thing. So we do the pre-blocking thing like that. It is a little challenging when you have a lot of schedule changes. You know how dentistry, I don't know if there's any other profession. I don't know what the medical profession is like, but man, I mean, I don't know. It's just always my whole 22 some years of doing this, and yours probably too. It just, there's always something going on. Like every day you go in, your schedule's ready to go, and then there's a change here all over the place. And hygiene particularly, it seems. Kids are sick, or mom's sick, or I got to go do this, I got to do that. I'm sorry, I'm not going to be able to make it, or whatever. And so you're always trying to play, fill the gaps, with people who are on a short call list or something like that. So it makes it hard to stick to a schedule like that, but we try to do that. Try to manage the time the best we can,
Yeah, we try to do that, at least with holding new patient appointments, because you don't want a new patient to call and say, hey, yeah, like you said, we can see you in 3 months, or we can see you in a month. Well, they want to get their teeth cleaned or get in for whatever in a week or two. So we hold time for that. But it is nice when we've done it to, know that you're going to have 2 or 3 crowns on the schedule and not like 17 emergency appointments, because those wear you out if you're seeing a bunch of those or a bunch of fillings every day.
Yes.
Yeah, I've worked where we didn't follow that. I worked in an office where it was just kind of whatever you can put in the schedule, put it in, and it wears you out. I mean, it just burns you out because you'll go one day where it's just like back to back to back to back to back quadrants of composites, and it's just I like having a variety if I'm doing general dentistry and breaking it up.
Yeah, and I like how this Dr. Deems put it. He didn't call them emergencies. He called them urgencies, which is probably a better way to put it in dentistry, because there's very few emergencies in dentistry that you're going to die from. People have a toothache that they've neglected for months, and all of a sudden they, want to get in. But it's an urgent thing to them, but it's not an emergency.
Yeah.
Yeah, true.
So let's go to this next one. I've lost track. We're going to go to Marcus on this one. And it is be rigidly flexible. What did you get from this one, Marcus?
Well, it talks about, when you have policies, it's definitely important to have policies and guidelines in your practice that your team is aware of. But it's another thing that you can never plan for every contingency, everything that might come up. So you got to be a little bit flexible. I can't remember where I learned this along the way, but some management consultant or somebody, it may not even be a dentistry person, basically said they tell their staff members that they're free to make any decision that doesn't follow the policy, if it's not more than a $50 decision or $100 decision, or you could look at your practice and kind of figure that out. So that kind of gives your team the ability to be flexible, to bend the rules a little bit in a certain situation, but it doesn't give them just freedom to totally ignore the rules. And there's some things they're going to have to come and get permission for, or you're going to have to make a decision on. But that's kind of what I take from it.
Yeah, that's interesting. I have a small practice, and I'm the only dentist there, the only owner. And there's nothing, well, there's things worse, but it does get kind of annoying if somebody comes back and has to ask you if, they can write off a $25 charge or something. It's like, well, you could probably just make that decision. You know what I'm going to say. But Troy, in your practice, you've got a lot of dentists and a lot of staff. So who handles like these types of decisions for you?
Usually the doctor does, but I do find that occasionally the staff takes it upon themselves to make the decision for us.
Yeah.
Which, I mean, in most situations, our staff is very, very level-headed. Our ladies are awesome, and a lot of the ones that are making those decisions have been there for years, and they kind of know exactly how we would respond to it, so it's not that big of a deal. But I have noticed over time, I have become a little bit more, I would say, rigid on specifically charging for things that I normally or not. I wouldn't say normally wouldn't charge, but things that maybe I didn't charge for that I probably should have been the whole time. Like someone comes in, you smooth a tooth off for them, adjust a tooth, whatever, something small. You just have to charge for it. We have gotten so soft in dentistry that for some reason we feel our services aren't even worth charging people for. And I think it's to our own detriment. And so, on those lines, with charging folks and stuff like that, I think that you got to charge them, even if it's just a little something. I mean, it costs money to sterilize instruments. It costs money to turn a room over. It costs money for your staff to answer the phone, to your staff to seat them. I mean, it costs a lot of money. You do anything for free, it's costing you money.
Yeah, those are great thoughts. Like if you go get a surgery or something done at a hospital, they're going to charge you for a Tylenol, and you don't even think to like argue it. You just know you're going to get charged for that. But the smoothing a tooth off thing is a big one for me because I used to like smooth those off. It didn't cost me anything. I'm not going to, no need to charge. And now, I do charge for those things, but I still get my staff asking me, hey, are you going to charge for that? Well, yeah, I am going to charge for that. But, 5 years ago, maybe I wouldn't. So, but yeah, like now, they asked me to smooth their tooth off. If they asked me to put a filling in their tooth, we would definitely charge for that. So why wouldn't we charge to smooth off a tooth? They asked us to do that.
But it only takes you 2 minutes. So,
And that is that is the problem right there. Yeah. And, part of me thinks, yes, I didn't use any supplies, but I did use supplies. And so I can rationalize it. And what it comes down to is we're people pleasers and we just don't want people mad at us probably.
Yeah.
Yep. I can think of a patient, this has been several years ago, and he asked me to smooth down like an old crown. I didn't do the crown, and I charged him, I don't know how much it was. It was under $100 for a like limited occlusal adjustment. And he came in for his next hygiene appointment and he asked me about it. He said, hey, yeah, so you smoothed that tooth off and then you charged me for it. I said, yeah. And he just kind of sat there and I'm just like, let's see what he says. He's like, oh yeah, just kind of stammered over and then we moved on. It was like he didn't quite dare come out and say, can you write that off? Like, because I don't know, I guess I felt like I didn't really stand my ground. I just didn't give any, leeway to him. So kind of annoying stuff like that.
Mm-hmm.
Let's see, Troy. This next one, number 23, is call your patients after difficult appointments. Do you call your patients after a rough root canal, extraction, anything nowadays?
I'm glad you said nowadays.
Well, I used to do it a lot.
I used to do it a lot. I used to do it all the time. Anything with any kind of, significant, thing like a crown or whatever, root canal, whatever. Extraction, I used to call, yes. Do I do it now? No, I do not. Is it a good idea? Yeah, probably is. I mean, I think it's good that the patient knows you care about them, that you're worried about them, that you want them to, to know that if they need something, they can call you, which I don't know. I hope that they can feel that way anyway. But honestly, I'll be straight up honest with you. I just have lost the energy to do it. I work, I go to work now and I come home. I'm so excited to leave that I'm just like, I'm done. You kind of get to the home stuff. So I am terrible at it now. I have not done it. I actually I do it occasionally, but it's not nearly as common as I used to.
Yeah. When I was first out of school, when we were first in practice, I called the guy and asked him. I just did some fillings on him. Called him and just checked on him. Hey, how's it going? You know, how your teeth feeling? And he was like, I'm good. Did something go wrong? Like he was like suspicious of why I was calling him.
Why
And
were
it
you
was
calling me,
like,
man? Yeah.
Yeah, like, oh, okay.
I forgot to tell you,
And
I broke the file off.
yeah, like stuff like that. But I don't know, Marcus. I'm guessing you probably don't do it for when you're doing crowns, but have you ever done that as a normal practice in practice?
So the guy that owns the crowns place, he does want us to message the patient. So through the practice software, you can send a text message to the person's phone,
nice.
but it doesn't connect it to your phone like my phone.
Okay. Nice.
So we do at the end of the day, you know, just text all the patients. Hope you're doing well. Thanks for coming in. How's your tooth doing? You know, that kind of thing. And I'd say probably 9 times out of 10, it's, you know, doing great. Thanks. You know. So it does build goodwill, but
yeah,
I don't know if I had to call every one of the patients, if I would be up for making, you know, all those phone calls at the end of the day. Is it a bad thing to do that? I don't think so. It's probably a good thing, but just, I know my personality, kind of like Troy, is just like, by the end of the day, you're exhausted and, you know, ugh. But sending a few quick texts like that, that's been okay.
Yeah, that's nice. And part of me is I want ignorance. I don't want to know, because like if their tooth does hurt, I almost don't want to know. I don't want that stress. And so maybe that's part of it. Like, you know, I did a root canal. I'm just, as long as I don't hear from them, I'm going to assume that it's feeling okay. But so maybe that's part of the reason I don't do it. But I think it's more the energy and taking the time to do it. Let's see. Exactly. This next one, Marcus, is stay on time. There's nothing that irks me or annoys me more than when I get behind schedule, or, you know, when I'm on schedule, but the staff takes too long to clean up, and it's like, now we're 3 or 4 minutes behind. We told this patient to be here at 2:00, and they're, you know, we're not ready. So do you, I don't know, are you staying on schedule for the most part with your practice?
We really tried to, and I've always really tried to, and I think it's good, because it's hard to tell people, you know, be on time. If you're more than 10 minutes late, we won't see you, or maybe you choose to charge a late fee, or, you know, whatever. It's hard to do that if you don't keep the appointment times on time. I mean, I know I go to I mean, that's one of the things I hate going to the doctor, like the physician, is they're notorious for being that way. Like, you have an appointment at 2:00, you get there a little early and check in. It's like 15, 20 minutes before they take you back. And then it's another 10 or 15 before the doctor comes in. So, and I don't know, I just think it's impressive to patients, and they appreciate it if we run on time. And it doesn't always work out that way that you can. Sometimes things come up, but that's where I think it's important that you or a staff member lets the patient know, hey, we're really sorry. You know, we're running behind. We had this come up. We'll get you back there as quick as we can, you know, that kind of thing. That goes a long way, just communicating.
Mm-hmm.
Yeah, just an apology is most people will say, oh, that's no big deal. And I think part of it is, like you said about going to a physician, they are always behind. So if we're 10 or 15 minutes behind, it's like nothing. They're expecting to be 45 minutes behind or something. So, yeah. Do you guys, with all your staff and dentists and everything, hygienist Troy, do you guys stay on schedule pretty well?
Yes, absolutely. That's one of our main things. I mean, personally, Yes, I do. I can't stand running late. And I think that patients appreciate that. Like Marcus said, is just, you know, their time is precious too. You know, they don't want to be at the dentist necessarily. There's probably about 1,000 other places they would rather be. So if you can get them in, get the things done, and get them out of there as quick and painless and as efficient as possible, they'll be very, very happy. And I think that goes a long way. If you're running behind and you know, putting them behind for whatever they've got planned next, I think that just annoys people. I'm the same way, man. When I go to the medical doctor and I'm sitting there for 40 minutes and nobody even says anything to me, I'm just sitting there waiting. That drives me insane.
Yep.
So I just try not to do that to my patients. Yeah.
Yeah. So help us understand this last one, Troy, number 25. It is make sure every patient understands their oral condition. What do you take from that?
Just basically telling them what's going on, I guess. and make sure that they know, whether or not your insurance will cover something. You tell them, you have periodontal disease, or you have this, or you have that. I think oftentimes maybe we refrain from telling them stuff because, well, they're not going to do this anyway or whatever, but I think that you owe it to them to tell them what's going on, and whether or not they make a decision to treat it or not, that's on them. But at least they're fully aware. I've had several patients, you have teeth that are just, you're like, I don't know how you're not feeling pain. This thing is like going to go at any moment. I mean, I had several of those this week, and they're just like, yeah, it doesn't bother me at all. I'm like, well, I want you to be aware of it. We need to take it out, or we need to do an endo. We need to do this. And I don't want to. Okay, well, at least you know. And so when, it blows up on Saturday night, you can know that I'll probably get back to you on Monday morning.
Yeah.
Because if you don't do anything about it, why is it all of a sudden an emergency on my fault, on my part?
Yeah.
So,
I mean,
anyway,
it is so
I mean.
nice. Yeah, I do. And it is so nice when you tell somebody, hey, I think this tooth might hurt after you do a big filling or something like that. And then when it does, they're like, oh, yeah, you said that would hurt. But when you don't tell them that, or you don't tell them they have a broken tooth or filling like that, and you're like, oh, yeah, you got a broken filling. Well, how come you didn't tell me that before? Then it's a little more difficult of a conversation. So, yeah, Marcus, in your situation where you're doing only crowns, do you do like what kind of exam do you do? Do you look at other teeth? How do you determine like what kind of treatment to tell them about?
So most people that are coming to us are coming because they expect that they need a crown. They've either been to the dentist and they've been told already, or something's been broken for a while and they heard about us and they're like, oh, maybe I should go in. I probably need a crown. So they kind of already come to us expecting it, which is really nice. Yeah. But it's still a good idea, and we do do an exam, we take an X-ray, we look at the tooth, and it's a good idea. A lot of times I'll show the patient the X-ray, or we use an intraoral camera and show a picture of the tooth and explain to them, yeah, the crown is needed because of blah blah blah. So.
Okay. Cool. Well, guys, we made it through all 25 of these. It only took us about 2 or 3 months, but we got through them.
Well, there was a lot.
I don't know if they were helpful.
Think about.
Yeah, that's true. We had to think about this. We actually just mostly got delayed and had real life stuff come up. So, you guys have any other final tidbits, nuggets? You want to add like a 26th to this list? Anything like that? Any other suggestions for the listeners?
No, I think I like what Marcus was. Marcus has a unique situation where he has people coming to him wanting his service.
Yes.
And that's something that you just don't. I mean, I guess, at certain times you get that where patients are in pain and they want you to get them out of pain or whatever. But I would say the majority of people, with the cavity or whatever, they aren't having pain. They don't want the cavity. They don't want to pay for it. They don't want this. Marcus is in a unique situation where people actually want his services. It's like Apple phones. Nobody has to have an Apple phone, but you want an Apple phone, Marcus has marketed this to a point where people love him and want his services. I'm thinking that I need a crown just because Marcus does those, and I know he cares.
Yeah, that's a great point. That is a great point, though, because people come to us, Troy, and they have a toothache, and they want to be out of pain, but they don't want the tooth pulled because they want to keep their tooth. They don't want a root canal. What they want is antibiotics or pain meds, and then they want to keep that can down the road.
Makes it go away forever.
Yes.
How many times did you get that?
I had a patient recently who came in for a toothache, and it was 16 or 17. I think it was 16 that was hurting him. Well, I've told him for about the last 5 years that you need to get your third molars out. I mean, these were like, there's no room for him. They're going to cause trouble. He just never did it. And then he comes in and he's like, was like kind of deer in the headlights. Like, you need to have these out. So why do you look surprised? And he was trying to think like, well, maybe it's number, like trying to say maybe it's 14 or 15. I'm like, no, it's not. You've got to have these teeth out. And it's just, but yeah, with Marcus, they go in there, they need a crown. They want a crown. Nobody,
have this money,
very few people come to us wanting.
Yep.
Yes.
I want
that's
to give you this
point.
Money. Can you please, Marcus, please give me a crown. I want this. Here is my money. Take it.
And it's true. They know how much they're going to pay. They come to us. They're like, oh, well, that's going to cost me a lot. Well, yeah, unless you keep for like 5 years. Yeah, no,
Marcus
it
doesn't
won't.
even get those questions.
That's right.
My
So
gosh,
that could be
Marcus.
number 26.
You're
That
the
could be
man. There you
26
go.
on this list. Is follow Marcus Neff's example.
Yes, because Marcus has it down.
Yep.
Yeah, there you
Okay.
go.
That's it.
Are you
That's
blushing,
it.
Marcus? I can tell you are.
I'm gushing. I'm not blushing.
guys.
All right. Well, Marcus, do you want to tell everybody where to find us?
Yes. So you can find us on Facebook, and Dental Realist is our handle there. You can check us out anywhere that fine podcasts are sold, or for free.
That's right.
podcast.
That's right.
Our podcast is well worth the price.
That's right.
So we also have a couple of books out there. So you want to be a dentist, and so now you're a dentist. Great, easy reads, but packed full of impactful, important information.
Just like this podcast.
Yes.
Troy, do you
Yes.
have anything you want to leave the listeners with? Anything about second
No.
molars?
Nope. I've said
Yeah.
my piece, and I'll just sit here and have PTSD every time I see it on
Yes.
my schedule.
You're not kidding, man.
Not sure.
They're just terrible.
You know, sometimes people can just open and their tongue's not in the way, their cheek's okay. They got plenty of room. You're like, okay, this is going to be fine. And then you've got other times you're just like, why am I trying to restore this?
Yeah, it's
Um,
true. Yeah.
I'm whining too much. I apologize. I didn't mean to whine
You're
so
great.
much. They drive me crazy.
The listeners understand. And if they don't understand, if they're still in dental school, they will understand one day.
Yes.
Yes.
After restoring second molars for 20 plus years, you will understand.
Yes, and you'll want them all extracted also.
Yep.
All right. Well, thanks everyone for listening, and we will talk with you on the next episode of the Dental Reels podcast.